5 things you're doing that's making your UTI worse. Hello, I'm Dr. Taiwo Durawade. I'm a gynecologist and I practice in the South Suburban area of Chicago. All right, number 1, you're not drinking enough water. Drinking a lot of water flushes your bladder, helps you to pee it out so the bacterium doesn't hang out in your bladder and cause an infection. Number 2, holding your urine for too long. There's bacteria there, you hold it for a long time, it's going to linger, it's going to fester, it's going to cause an infection. So emptying your bladder often is also one of the ways to reduce your UTIs. Number 3, not voiding after sex. Remember, during sexual activity, there is an exchange of bacteria, especially if there is no protection, if there's no barrier protection. There's skin-to-skin bacteria. People are exchanging organisms. Those bacteria can hang on to the urethra, which is where you pee from, and that's in the opening of the vagina. And so peeing, emptying your bladder, or voiding, allows you to get that bacteria out of your vaginal environment, reduce the chances that it gets into your bladder and causes an infection. I always tell my patients, pee after sex, wash with water. Number 4, relying on over-the-counter stuff or homemade remedies. Now, those might help your symptoms like cranberry juice, over-the-counter azo. They might help the symptoms of bladder irritation, but they're not an antibiotic. They don't cure the bacteria or kill the bacteria. So that can make your UTI worse in that my symptoms are better, but they came back. That's because you haven't gotten rid of the bacteria that's in your bladder. And finally, number 5, incomplete antibiotic treatment. Sometimes when we prescribe antibiotics and, I'm following up with my patients and they say, oh yeah, I was feeling better after day 3, so I didn't take the rest of it. You have to finish the antibiotics. This is because bacteria is smart. It gets very smart. It starts to recognize that, oh, this is how this antibiotic works and becomes resistant to the antibiotic. And if you have UTIs frequently, then the antibiotic choices we have for you get smaller. Because now the bacteria that keeps infecting you is smart and is now resistant to 4 out of 5 on the list. So if you're giving an antibiotic, you got to finish it. You got to finish the course so the bacteria doesn't know what's hitting it and doesn't have a chance to form a resistance to it. So if you're having UTIs after sex or bladder infections after sex, bladder infections, whether or not you're sexually active, but they just keep happening, something else might be causing it. It might be vaginal dryness. A lot of people don't put those two conditions together. Even primary doctors don't put those conditions together. They just give you antibiotics and say, maybe it's the diabetes that's making you have recurrent UTIs, but sometimes it's vaginal dryness. The moisture and the lubrication in the vagina used to help to not allow the bacteria to stay, but now there's not as much lubrication, bacteria is hanging around. And as you know, I've talked about this several times, I have the best treatment for vaginal dryness, vaginal rejuvenation with laser, and it helps you get your natural lubrication back. It's not something you have to do every day or take every day or use every day. It's a 5-minute procedure in the office. No needles, no incisions, nothing. Go about your daily activities. It makes a difference. It works, okay? So if you're in the Chicagoland area, I'm in the South Suburbs, schedule a consultation. Let's talk about your symptoms. Let's see if it's vaginal dryness causing the recurrent UTIs. I can help you. The number to call or text is 708-340-1167. I hope to see you soon.